Welcome to Counterpoint. I'm Tanya Granick-Allen. Are you happy? How is your health in general? Your mental health? Your wellness outlook for 2022? These are serious questions, especially considering what we've had to live through for the past 2 years. Many of us have experienced perhaps unprecedented mental health decline, weight fluctuations, and physical health lapses due to the frequent and unpredictable changes in society due to COVID. And I have done several shows on the toll COVID has taken on those with mental health diagnosis, the homeless, those struggling with addictions, children, and families in general. But today I want to change gears and I want to focus far less on the fear and anxiety of COVID and its related measures and focus more on how we can improve our well-being, help equip ourselves, and build resiliency for 2022. And I know some of you might be thinking, but how can we do that? We don't even know what tomorrow will bring, if there will be another lockdown, what restrictions may come, and when the new variant will arrive. But we have to help ourselves and we have to equip ourselves. Later in the program, we will hear from Emily Kennedy, a health and wellness coach and registered holistic nutritionist. But now we're going to hear from one person who is helping us to understand health, wellness, and the importance of happiness, and that is Dr. Tim Lau, Associate Professor of Psychiatry at U of Ottawa and Director of the Joy at Work for the Department of Psychiatry. Thank you, Dr. Lau, for joining me today.
My pleasure. It's so much fun to be back with you.
Yeah, well, this is a very important topic. And for once, I kind of really want to focus more on the positive and what we can do and not be so, grim and fearful about what perhaps the future may hold. So let's dive right in. So how does, in general, our health and wellness impact our daily function, in your opinion?
Well, I think both at work and at home, our levels of happiness are connected to our health. Because I think health is much more than the absence of disease. And we do have a tendency to focus on disease and what's broken. But part of this initiative that we started in our department is to try to focus on flourishing and on positive things. Because, I think both for our patients to whom we want to get them, not just not having symptoms anymore, but also living a full life, we also want the same for ourselves. Right. And they're different things. Like focusing on not having, say, a pathology is very different. So focusing on what's broken is very different than trying to build up the best things in life.
I agree 100%. So how does happiness factor into our health and wellness? Sometimes I find if I'm very stressed out or there's been perhaps like a negative news conference and I'm in the news, so I'm always watching the news, but I've perhaps watched too much news one day and there might have been a press conference that has kind of set me off. I feel that everybody around me, my mood goes down and everybody around me is sort of brought into this toxic environment. And I can feel that. First of all, am I alone? Am I the only one? And number two is, how does happiness really impact how we behave?
Well, happiness largely is an internal thing. And a lot of things that happen outside of us, like circumstances and things in the news, they can change how we feel. But part of it is because of how we process it or how we let it affect us. The researcher and Nobel laureate Daniel Kahneman once described, at least with our brain wiring, that negative things tend to stick to us like Velcro, and positive things tend to bounce off us like Teflon. So, in general, of a ratio of 3 to 1, and in marriage, probably 5 to 1.
Oh, really? Okay. Good to know.
So you need 5 positive things for every negative thing to balance out. So,
okay.
So I think the thing is to realize that, research shows that only about 10% of our happiness depends on the circumstances. The rest is internal. And you only have to look at people that win lotteries as opposed to people that break their necks. There is actually no difference after a year. Or gold medalists and silver medalists. They did a study in 2013. It was a Scientific American. There was a study that was replicated in the summer of this past year, showed the same thing. People who win bronze medals are happier than people that win silver medals. And a lot of that has to do with the way we process it. It's what's called the counterfactual narrative. In our heads, we think a lot of things, and it's based on how we process the information. So the bronze medalist is thinking, I could have come fourth, and the silver medalist is thinking, I could have won gold.
Wow. Okay, I want to unpack that a little further. We've got to cut to commercial, but we'll be right back. Welcome back. We're talking about your health, wellness, and well-being in the new year and how happiness might factor into that. And joining me is Dr. Tim Lau. Dr. Lau, before the commercial break, you were mentioning a study that compared, bronze, silver, and gold medalists of Olympic gold medalists, and that in fact it was the bronze medalist who had the most happiness as a result. And so that seems completely counterintuitive, because I would say, well, if I didn't win gold, then I didn't win at all. Maybe I'm too competitive. But what is the justification for this?
Well, they actually studied both the facial appearance on the podium. You can actually see pictures of people winning silver and gold medals, but also through interviews. And there was this nice interview with Allyson Felix. She's the most decorated Olympian in U.S. in U.S. gymnastics history, and or track and field rather. And she described how her bronze medal she won after, I don't know if you remember the story, but she became pregnant and she had a contract with Nike. She was dropped.
Yes.
But then went on to win a bronze medal. And she said that was the most meaningful medal she had won. And she went on to win in silver and I believe gold afterwards. But in the story, it's very beautiful because she was saying a lot of it's in our heads. It's what we expect. And we can control that. From a cognitive behavioral point of view, we know that we can't control how we feel just by willing it.
Right.
But you can't control how you think and what you do. So an example of changing how you think is to look at things more realistically. For those that are really hard on themselves and think of themselves as failures, we often have this negativity bias and a confirmation bias based on things that happen to us related to that negative, that 3-to-1 ratio I was telling you about earlier. So we can change also what we do. Eating and exercising are examples of constructive things that will make us feel better. But we feel like, and the thing is, we think we can just will ourselves into feeling happy, but we can't. What we can do is change what we do to improve our mental state.
Okay.
There are
I was going to say, we only have about 3 minutes left, and I want to really understand this program that you're the head of that's called the Joy at Work program. It sounds so lovely. What exactly is this?
Well, the idea is actually to both improve faculty engagement, and we realize that for a lot of people at work, we are not functioning to our potential, and there are many reasons for it. One reason is we don't feel like we're doing something meaningful, or we feel like we're accomplishing something, and that's important for us. And we're also often not challenged. We need to have our skill set matched to the challenges we face. If you're too challenged and you don't have enough skills, you have anxiety. If you're not challenged enough and you have lots of skills, you have boredom. So the idea is to make sure that people are engaged in meaningful work. That makes all the difference when you feel like you're actually accomplishing something. So at work and at life, you want to be doing things that are meaningful to you, that there's a purpose, because that changes everything. Living with intentionality changes everything you do.
Yes, I agree with that. Although, our studio doesn't have a resident psychiatrist. I mean, this sounds a bit like a dream for the Department of Psychiatry, in which you have this program. But how practically can companies do this? Should they offer more counseling for their employees?
I think it's not so much counseling, but recognition. And it doesn't, at the top level, it could include awards, but just recognizing the good work people do.
Okay.
I think people don't do that enough. They don't say, that was a good job, or the things that you did this last year. Look at all that you accomplished despite COVID, for instance, or while you were at home. So I think it's just recognition of the good work people do. That's just, I think, very meaningful for us to feel like we're contributing, that we're valued. Those are, I think, parts of human nature we all want.
And you can even transplant that from your work environment even to your home. How many of us, fail to thank or show gratitude or recognize our partners' contributions, or the children even? They help out emptying the dishwasher. Are we taking that moment to really look them in the eye and say, thank you, that meant so much?
Absolutely. Yeah. And you mentioned transplants and hope. As psychiatrists, we often see people who don't have a whole lot of hope and they need a hope transplant. But the same, the kind of thing is you want to let them know that there is hope. And that's also the same for our colleagues and for our work in general. We want to realize that there is a choice we can make to have hope in a better future. We can be constructive. And that's the antithesis of being more destructive and negative and focusing on what's broken. And rather than, we need to focus on things that unite us and that make us better.
Welcome back. And now as we head into 2022 and make those resolutions, I want to hear from Emily Kennedy, a health and wellness coach and registered holistic nutritionist who's going to help us with some practical tips and general outlooks for 2022. So Emily, thank you so much for joining us. It's that time of year when people start thinking ahead to the new year. Perhaps they already have some resolutions or they may be in the process of contemplating some new resolutions, some new ideas for a new year. How should one approach New Year's resolutions? How should we make them?
Right, so you're absolutely right. It's that time of year again. And the problem that people get is making a resolution that actually sticks or is sustainable. So what I want to encourage people to do is before they even consider what they want to change or how they want to go about changing it, think about why is it that they want to make that change. So 10,000 foot view, right? Zoom out in your life and think about what are your priorities? What is your vision for yourself in terms of your health and your wellness? And whether or not that perspective helps you to be happier. So this ties in maybe a little bit with what your previous guests talked about, in that happiness means that we are actually giving of ourselves and we're actually seeking to contribute to the lives of others. So what our health and wellness goals should actually do is help us to live lives that are more contributive and more empathetic to the wellness of others, as opposed to, solely fixating on what we want.
Oh, wow. Okay. I never seem to run across persons who approach it from that perspective, or I never thought about it from that, rather than, I want to lose 10 pounds or do this or stop smoking. It's the why. Why do you want to stop smoking, or why do you want to lose those 10 pounds? And to approach it from the perspective of wanting to contribute to others, that's nice.
Yeah. So, this comes from over a decade of practicing as a health coach and as a nutritionist and seeing people fall off the bandwagon when it gets hard, right? And we also know from psychology, which health coaching uses a lot of, positive psychology, that we are more inclined to do things that are helpful to somebody that we love, as opposed to just strictly for ourselves. Mm-hmm. Case in point, we're both mothers, right? We would give our right arm for our child.
Absolutely.
Okay. And think nothing of that sacrifice. Why? Because we love that child and we see if they are truly in need of our assistance, we want to go the extra mile for them. And so you can parlay that into how do you set a resolution that actually deeply is satisfying. And as human beings, what's deeply satisfying is knowing that we have a connection with others and we are actually strengthening our ability to help others through improving our own bodily wellness.
Wonderful.
Does that make sense?
Yeah, it does. It's endearing too. I don't know how to explain it, but it makes me happy to hear it. People tend to focus, we'll start with diets. People tend to focus on diets that they want to, and it's not dieting necessarily to lose weight, but I want to improve what I'm putting into my mouth. I want to approach food in a different way. I want to maybe go low and slow, rather fast and rushed. And COVID, for all its failings and concerns, seems to have slowed things down a bit, and I'm not complaining about that. How should people approach diets or changing their diets in a new year?
Yeah, so definitely approach it from the standpoint of what is immediately feasible to you. We're all inundated by information, whether it's through credible sources or through anecdotal sources like social media. So first and foremost, turn those sources of information off and assess where you are, practically speaking, in your life and in your family's life. And choose a change. It doesn't really matter. Personally, I don't subscribe to any one diet pattern or diet trend, but I encourage my clients to pick a change that is actually easy for them to stick with, enjoyable to stick with, and that they've assessed will actually be effective towards the goals, towards that, satisfying resolution that we just talked about.
Because it's true, I find it challenging. You really have to assess, okay, is this actually practical? As a parent, you don't want to be on one diet and then cooking perhaps a meal for your children on a different diet. You could be in the kitchen all day. We only have 10 seconds left, so we're going to cut to commercial break. But when we come back, I want to talk about how we should be approaching our mental health in the new year. It's so important. We'll be right back.
Okay.
Welcome back. We're joined by Emily Kennedy, a health and wellness coach and registered holistic nutritionist. And before the commercial, Emily, I said I want to talk about mental health. Now, we did have Dr. Tim Lau, a psychiatrist, expand at length about happiness and mental health. But food also factors in greatly with one's mental health. Could you explain to our viewers how it impacts our sense of well-being?
Yeah, absolutely. So you want to remember the basics of blood sugar control. That proverbial feeling hangry, that is, not a sign that you may have a condition that needs professional help. It could just mean that you need to think about how you're timing things and how you're structuring your meals so that they encourage blood sugar balance. So, I'm not going to delve into the clinical side of mental health and how what you put in your mouth, the nutrients you put in your mouth impact certain balances of neurotransmitters or anything. I want to first and foremost to hit the low-hanging fruit and make sure that people are aware that how long they go between meals or snacks and what they are actually eating in terms of macronutrients and micronutrients actually has an impact on their blood sugar. And we respond differently to highs and lows in blood sugar, and to be aware of what your personal response is to a crash, so to speak, or a surge in blood sugar is where you want to start that conversation about mood or mental health.
So there's no kind of one-size-fits-all approach to blood sugar management?
Generally, no. I mean, we do know quite a lot from diabetes research about what foods spike blood sugar. Okay, so generally speaking, those that are high in refined carbohydrates are going to always produce a surge in your blood sugar levels. And we know that fats and proteins don't do that. They have a stabilizing effect. But beyond that, personally speaking, your stress level is not the same as mine. My activity level is not the same as yours or the next person over. If you're dealing with illness, recovering from a surgery, recovering from a recent illness, your metabolic rate and the rate in which you use glucose is not the same as the next person. Mm-hmm. So, you have those general principles, but then you do need to drill down to what is the individual's unique situation.
Okay. You hear, okay, we're going to talk a little bit more about diets because, again, that happens in the new year. People make resolutions. I sometimes find it all just such a mess. There are diets that say, eat more carbs, don't eat carbs, don't eat potatoes, eat potatoes. Sometimes there's such contradictory information out there. And eat for your blood type. No, just eat for your DNA. It's all very confusing. What are some practical tips in general for people to go forward with in the new year?
Eat what is satisfying to you, Tanya.
That could be a tub of ice cream.
Yeah. Eat what is real food. So towards your point about a tub of ice cream, we're familiar with our nutrition facts panels. We know what's in our food. We have more nutrition information than we've ever had at any point in history. So we know how to recognize an item that may from a sensory standpoint, satisfy us. But if you look at what's actually in it, it actually is just a chemical slurry. It doesn't fit into my definition of what is food, which should be what is nourishing. So I would, again, bring it back to the basics. Try to filter out all the information that you have about various diet trends and go back to the basics of eating something that resembles whole, natural, unprocessed foods. Stick to, the highly recommended outer, the perimeter of your grocery store. Pick foods that actually require you to prep, and ideally as a family getting involved and nourishing yourself, not just from the standpoint of nutrition, but from the standpoint of your connections with your family and what really feeds us, our hearts and our souls, so to speak.
Oh, that's so well put. And I never thought about the outer perimeter of the store, but you're right. I guess a lot of the refined carbohydrates are in the simple refined carbohydrates are in the middle. Listen, Emily, thank you so much for joining us today. You've given us some excellent tips, some practical tips as we look towards 2022. So thank you.
Thank you for having me. Merry Christmas.
Merry Christmas. A lot to digest there, figuratively and literally. But at the end of the day, it is important that we maintain a proper balance of health and well-being. Happiness clearly factors in centrally into that. And I think as we approach this new year, or maybe we've just started it, that we approach it with realistic goals and try to see how we can make ourselves and others better in 2022. For Counterpoint, I'm Tanya Granick-Allen.